Good morning, and welcome to the 8th Annual JWB Children's Summit, Restoring Hope. My name is Mike Mccabe, and I'm the chair of the Juvenile Welfare Board. For 75 years, JWB has invested in Pinellas County children to improve their futures and strengthen their lives. We're excited to have a record number joining us today who share our vision that all children deserve equitable opportunities to fulfill their potential and achieve meaningful and purposeful lives. I'd like to start by acknowledging my colleagues from the JWB board. The Honorable Patricia Moore, 6th Judicial Circuit Board Vice Chair. The Honorable Rick Butler, Pinellas Park City Councilman, Board Secretary. Mr. Brian Unks Jr., gubernatorial appointment. The Honorable Bruce Bartlett, Pinellas Pasco State Attorney. The Honorable Pat Gerard, Pinellas County Commissioner. Dr. Michael Grego, Pinellas County Schools Superintendent. Division Chief Jim Milliken, gubernatorial appointment. The Honorable Sarah Molo, Pinellas Pasco Public Defender. And Mrs. Susan Ralston, immediate past chair. It's a pleasure to serve alongside each of you, and I thank you for your service to kids. In 1945, few alternatives existed for troubled and dependent minors in our county, other than adult jails. Early champions drafted legislation on November 5th, 1946, the Juvenile Welfare Board Act, or Special Act, was voted into law. It was our nation's first independent board enacted to guard the rights and needs of children, a point of pride in Florida and Pinellas County's history. Earlier this month, during Children's Week, at our state capitol, Representative Chris Latvala, chair of the House Education and Employment Committee, presented a special tribute to mark JWB's anniversary milestone, 75 years of making Pinellas County children a priority. On April 29th, we will host our 75th anniversary awards luncheon at the St. Petersburg Coliseum, and we invite you all to attend. The event will honor our 12 Kids First awardees for their outstanding service to children and families during the pandemic. We will also recognize the recipients of the H. Browning Spence Education Award, which help former foster and homeless youths achieve their goals. And we will announce the winner of our inaugural Dillinger Mccabe Leadership Award, honoring the legacy of two longstanding JWB board members, retired public defender Bob Dillinger and the late state attorney Bernie Mccabe. During their 20 years of service, these two men were cornerstones of the JWB board. They were fierce advocates, formidable leaders, and their dedication to Pinellas County children is unparalleled. While they did not always agree, they found common ground when it came to putting children first. The Dillinger Mccabe Leadership Award will honor a remarkable Pinellas County leader who emulates the qualities of these two champions for kids. Mark your calendars for April 29th and look to the left of your screen in the summit materials for the save the date invitation. At this time, I would like to introduce Beth Houghton, JWB's Chief Officer and a passionate advocate for children and families. Beth?
Thank you, Mike. If 2020 was a year of resiliency for JWB and our partners, last year was definitely about restoring hope. As Mike shared, JWB was created in the 1940s to find solutions and invest in services for children that didn't exist at that time. Through the years, we hired the county's first social worker, advocated for legislation to create a child care licensing board, invested in latchkey after-school programming, established neighborhood family centers as trusted hubs in their respective communities, and so many other firsts. Data-driven, research-based, accountable, resilient, nimble, and responsive to the needs of Pinellas County children and families, just as true in 1945 as it is today. At this time, I'd like to take a moment to thank our JWB staff, community councils, funded agencies, and initiative partners for their resiliency over the past 2 years, and for their collective efforts to help restore hope for our county's children and families. Recently, our board approved the release of a new competitive procurement, requesting letters of intent for new strategically aligned programs from Pinellas County nonprofits. These dollars are intended for programs that JWB does not currently fund. The first round of procurements will be focused on 3 of our 5 key result areas: early childhood development, prevention of child abuse and neglect, and strengthening community. Next year, we will release a procurement for the final 2, school readiness and school success. These funds are intended to address unmet needs of Pinellas County children and families, increase efficiencies, and promote inclusion by inviting a wide range of innovative ideas from our county's nonprofits, and that align with JWB's 5-year strategic plan. JWB understands that there are gaps in services for children and unmet needs of families, which may have been magnified since the pandemic. Moreover, our current investments do not address all approaches or interventions that could be utilized to achieve our goals in the JWB's 5-year strategic plan. This solicitation is aimed at closing these gaps and maximizing results for children within JWB's scope and our special act. This solicitation is intended to bring efficiencies in 2 main ways. First, by increasing the breadth of services for children and families to most efficiently and effectively meet JWB's strategic goals. Second, by the nature of the streamlined procurement process itself, designed to award and implement a cohort of new interventions at one time. It is also an efficient and effective way to listen to the community, an opportunity for JWB to lift up innovative ideas designed to strengthen Pinellas County children and families. JWB is approaching this solicitation through a lens of inclusivity, not only by the nature of the process itself, which is more streamlined, straightforward, and simplified, but also by listening to community voices as to the best ways to intervene to serve children and families. JWB seeks to invest in communities of color and those that have been marginalized beyond JWB's current portfolio, and to bring to the table innovative ideas and resources from those embedded and invested in their communities. This inclusive solicitation process seeks to add richness to JWB's portfolio, amplifies the ability to meet its strategic goals, and is aligned with JWB's organizational values of equity, diversity, and inclusion. You can learn more by visiting the Funding Opportunities page on our website, jwbpinellas.org. So now a bit of housekeeping. You can find the summit agenda, materials, and speakers pages to the left of your screen, and you can connect with attendees there as well. We invite you to share comments in the chat feature and follow us live on Twitter at JWB Pinellas, #RestoringHope. In a moment, we'll present today's program, Growing Hope, Protecting Youth Mental Health. It will feature 2 expert panels addressing the state of youth mental health and sharing efforts in place that are working to grow hope. You will hear a moving testimonial from Tampa native Johnny Crowder, who overcame adverse childhood experiences himself to become a successful entrepreneur as the founder and CEO of Cope Notes. And we will round out the program with a call to action for advocacy. Well, normally now I'd call for the lights to dim as we present our annual report video, Restoring Hope, a recap of the work and accomplishments of JWB and our partners last year.
My name is Linda Leedy, and I am the Chief Administrative Officer at the Juvenile Welfare Board. We are pleased you joined us today and continue to have patience for our conversation about youth mental health. It seems we can't turn on the TV or read our news feeds without hearing about mental health, from celebrities to sports figures. While the pandemic has shined a light on the topic to destigmatize it, COVID has also exacerbated it. It's really a double-edged sword. As Beth said, this morning you're going to hear from our panel of experts about the state of youth mental health and what's working to protect children and grow hope. Every one of our panelists today is intimately involved in the Children's Mental Health Initiative launched by JWB and our partners to increase prevention, early detection, and intervention. Given our full agenda and our little time lag here, we will not be able to do a Q&A this morning, but you are encouraged to put comments in the chat as you have been doing, and then our panelists have agreed to take questions by email after the program if you have them. And you can find the panelists' email in our Summit speaker pages. So without further ado, let's get started. Our first panel will focus on the state of youth mental health at the national, state, and local levels. But to begin, I'm going to introduce each panelist and ask them to respond to the same question. Our first panelist is Dr. Ulyee Choe, Director of the Florida Department of Health in Pinellas County. Good morning, Dr. Choe.
Good morning.
If you could give me one word to describe the current state of youth mental health, what would it be?
I would say concerning.
Okay, when the head of the health department is concerned, I think I'm concerned too. So let's hear from our next panelist, Dr. Jennifer Katzenstein. Dr. Katzenstein is the Director of Psychology, Neuropsychology, and Social Work, and co-director of the Center for Behavioral Health at Johns Hopkins All Children's Hospital. I'm sure she's going to pop up any second.
I'm here.
So what one word would you use to describe the state of youth mental health?
For me, Linda, it's concerned as well as overwhelmed.
Okay, so there's that word concerning twice. And so we're concerned, and now we're just over the top overwhelmed. Great. Okay, so let's see what April Lott, President and CEO of Directions for Living, and our final panelists has to say. Good morning, April.
Good morning, Linda. My word would be urgent.
Okay, so we have concerning, overwhelmed, and urgent. I would say that those three words clearly demonstrate the distress that our local experts are feeling today about this issue. So let's dig in a little deeper to get a better understanding of the scope of the problem. For the first time ever, the U.S. Surgeon General recently issued an advisory about youth mental health. So why is that a big deal? A Surgeon General's advisory is a public statement that calls the American people's attention to an urgent public health issue and provides recommendations for how it should be addressed. Advisories are reserved for significant public health challenges that need the nation's immediate awareness and action. I'm going to highlight a few startling statistics from the Youth Mental Health Advisory and then turn to Dr. Choe for my first question. Mental illness is the leading cause of disability and poor life outcomes in young people. And 1 in 5 children, ages 3 to 17, has a mental, emotional, developmental, or behavioral disorder. In a risk survey of high school students in 2019, so mind you, that's pre-COVID, 2019, the number of students who reported persistent feelings of sadness or hopelessness increased by 40% from 10 years earlier. That is 1 in 3 students. And when separated by gender, the rate is higher for girls. 1 in 2 girls reported persistent feelings of sadness or hopelessness. The risk survey also indicated that 19% of students had seriously considered attempting suicide, which is a 36% increase from the decade prior. And 16% had made a suicide plan in the prior year. That's a 44% increase. So between 2007 and 2018, suicide rates among youth ages 17 to 24 in the US increased by 57%. It's no wonder the Surgeon General is raising awareness and calling for action on this topic. Dr. Choe, can you share what you consider to be some key recommendations from that advisory?
I'd be happy to, Linda. And as you mentioned, it is timely. And I suggest anyone on this panel or listening to this presentation to take a read for yourself. Essentially, this advisory was a call to arms, a coordinated response to the crisis, and to provide various recommendations. And essentially what they did was they broke it down as to what an individual can do, what a family or caregiver can do, what the schools, the government agencies, non-for-profit organizations. So a fairly comprehensive document. Now, some of the key findings includes recognizing that mental health is an essential part of overall health, that mind-body connection is important. Empowering youth and their families to recognize, manage, and learn from difficult emotions and circumstances. To ensure that every child has access to high quality, affordable, and culturally competent healthcare. Support mental health of children and youth in educational, community, and healthcare settings. Addressing those things, those social determinants, specifically economic and social barriers. And then having that data and that research and the intersection with those technology companies. So again, I encourage everyone to read the document and see what you or your organization can do to tackle this youth mental health crisis.
And for the audience's reference, we have included the advisory in the Summit Materials link on the left-hand side of your screen. I do want to give a shout out to JWB and our community partners who recognized the increased need for behavioral health services and better care coordination a few years ago, and are already implementing many of the recommendations outlined in the U.S. Surgeon General's advisory. But of course, we still have a very long way to go. Now, moving from the national data and recommendations to the state, Dr. Choe, what's happening in Florida in terms of data and efforts to address?
Thank you for that. Unfortunately, the state trends is mirroring some of what we're seeing nationally as well. If you take, for example, the 2019 Youth Behavioral Health Survey, 7.9% of all high school students have attempted suicide in again, 2019. And if you break it down by gender, that's 9.6% of all females, 6% of all males. We also saw some increases in suicide deaths as well as ER visits. And to that end, and due to these concerning numbers, the State Health Improvement Committee has identified mental well-being and substance abuse as one of the top health priorities. And to that end, the state has put in additional dollars for mental health assistance, as well as other mental health support programs. They've started programs such as Hope for Healing, which is a website to access the resources in Florida, as well as programs such as Resiliency Florida to teach public health students, school students about resiliency in dealing with mental health issues.
Well, it's good to hear that so many new initiatives are beginning at the state level, and that the awareness is trickling down from the national to our leaders in the state. And of course, I always want to know what's going on in Pinellas County and how we compare. And Dr. Choe, I know you always come to meetings with data slides, so why would this virtual environment be any different? So we're going to put up your slides now that you can go through.
Thank you, Linda. Obviously, being part of our Pinellas community, we want to make sure that we put a focus on some of the numbers and the trends here in our county. This is the first slide you're looking at is suicide deaths overall. It's hard to separate youth mental health without looking at the overall picture, given the home environment and influences, traumas, the social determinants. So along that line, you can see, unfortunately, are increasing suicide deaths over the last 20 years. And you can also see that Pinellas in the black line is significantly higher than that of Florida averages. Next slide. So how do we compare to other counties in the state? And out of Florida's 67 counties, we are unfortunately fall into the third worst quartile when it comes to suicide death rates. Now, if you look at the how we compare among the largest counties in Florida, we are number 5, unfortunately, in the total count of suicide deaths. Whereas where our population is only 7th in terms of population, and it gets a little worse if you look at the rate. We are among the largest counties in Florida. Pinellas County, unfortunately, does have one of the worst suicide death rates. So looking at medical examiners data, this is from 2010. You can see that we've averaged anywhere from 166 to 222 over the last 10 years. And if you look at the youth suicide deaths, it's ranged from about 2 to 6 over the last 5 years. But obviously, deaths don't tell the whole story. If you look at ER visits due to self-harm, suicidal intentions, this includes the Baker Acts, you can see, unfortunately, among all the age demographics, we have increased over the last 3 years. More so for certain age groups. If you look at the 0 to 19, to those older than 55, this is where we've seen sort of the biggest increase. And if you look at the right line graph, you can see that those are the age groups that I just mentioned are the ones that are actually increasing. So something alarming and something that we need to continue to monitor. This is our Pinellas survey, and when we surveyed middle school and high school students, did you do something to purposely hurt yourselves and without wanting to die? You can see that overall we've improved over the last 10 years, but over the last 5 years, we are starting to increase as well. And similarly, if you look at those reporting feeling sad or hopeless for over 2 weeks, you can see that there has been some slight increases to that as well. And then lastly, obviously, childhood adverse experiences plays a huge role in leading to mental health disorders. Keeping in mind that studies have shown that those with 4 or higher on the adverse childhood experiences have a significantly higher risk of developing mental disorders or even physical ailments. There was a community health assessment survey conducted in 2019, and out of the respondents, and I think we had over 5,200, that unfortunately over 30% of Pinellas County residents had that score of 4 or higher. So a little concerning and alarming with these trends as well. So I do want to, in closing, mention that while these trends are somewhat concerning, I do still have hope. Hope in that we do have these amazing partnerships and collaborations at the table. I've always said that for any public health issues, such as mental health, it has always been a collaborative effort, and the JWB's Children Mental Health Initiative is a great example of that, bringing the right people to the table, and I hope that with these partnerships we can turn this around. So thank you.
Thank you, Dr. Choe. Yeah, those really are some really disturbing trend lines, but you're right, we're on it, we're working on it. And I know Dr. Katzenstein has seen this, on the front lines firsthand at Johns Hopkins All Children's. Can you share a little bit about what's going on there and what you guys have seen this year?
Absolutely, Linda. Thank you so much. And you've heard me say before, we were in a mental health epidemic prior to the COVID-19 pandemic, and the pandemic has really shown a light on that for us. I can't believe it's been 2 years. It has been an exhausting ride, and I think we're in the next level of burnout. And here at Johns Hopkins All Children's, we've seen a significant increase. We saw a 300% increase in patients requiring a Baker Act, and we only see children and young adults under the age of 22. What you can see here is a heat map of what our catchment looked like for our fiscal year 21. And because of the intense needs for mental health in our children and adolescents, and somewhat also as a correlation to our telepsychology program, we began a reach all the way from the Panhandle, as you can see, to Key West. And so families all across the state, with the darker color there, of course, representing a greater number of patients coming from those areas, coming to Johns Hopkins All Children's for behavioral health care and behavioral health support. In addition to those increase in Baker Acts, we've seen nearly a doubling of child abuse reports in patients coming to our hospital and needs related to psychosocial concerns and resources, a nearly double of our patients arriving with disordered eating. And then in addition to that, a significant increase in our outpatient referrals, with nearly 1,900 kids sitting on our waiting list right now. The needs are intense. And in addition to that, we have been working towards here at Johns Hopkins All Children's a full continuum of care. And our consultant group had recognized that there's a 250 bed plus shortage of inpatient psychiatric beds for kids in our 17 county catchment under the age of 22.
Wow. Did I really hear you right? An increase in Baker Acts of 300%?
3 times increase. That's right. So in the midst of all of that, of course, workforce is my passion. And so we've seen significant changes to our workforce. We, again, before the pandemic, when this amazing programming through JWB had started, you already heard me, Linda, complaining about the pipeline of high quality behavioral health care providers across degrees, across disciplines, not being sufficient to meet the needs, and that has even been further exacerbated. And I think we can all recognize that mental health really is a condition of pediatrics. 75% of our kids can be diagnosed prior to age 17. And so if we can diagnose them sooner and get them the treatment they need earlier, we can have the highest quality of life and in turn, stronger mental health functioning into adulthood as well. But again, as you've heard me say, Linda, this is all a challenge in many ways. Some of it is our Medicaid programming in the state, as Johns Hopkins All Children's does not have inpatient psychiatric beds at this time, and we're required to place all of those Baker Acts in our surrounding facilities, which, needless to say, is a challenge. We in the state of Florida cannot accept Medicaid as a result of that. So every Medicaid patient that we see for behavioral health here at Johns Hopkins All Children's is seen free of charge. So we need to serve all children, but also, again, that comes at a pretty significant cost until that continuum of care can be in place here. Or, of course, we advocate for some changes at the statewide level. So, again, multiple levels of concern in terms of the workforce that's necessary to meet that need, of course, reimbursement, but really most importantly, getting high quality providers into our area, ensuring that there's evidence-based care for all children.
So the word that you used at the beginning of the panel to describe the current state of youth mental health was overwhelmed. I think I'm getting it now.
It could be a personal issue too, Linda, but it definitely is something that across the board, I feel our systems are experiencing from every aspect, the supply, the demand, and how we can best serve the needs of our children.
Well, it's encouraging to hear that you guys are handling as many kids as you are, but like you said, we know there are many that cannot access this care. Mm-hmm. And certainly, as you referenced, the outpatient landscape is experiencing some of the same challenges, with too many children seeking services coupled with workforce and funding issues. So April, as CEO of a large community mental health organization in Pinellas County, can you share your perspective?
Yes, I can. And I think that the listeners and the viewers are going to start to hear and observe kind of some trends with, everything that Dr. Choe, and Dr. Katzenstein has said. I want to point out that, many of the risk factors that we're talking about during the pandemic, that we have to think about what the state of our children were prior to the pandemic, and those children then being at higher risk of mental health crises and mental illness. But for children who had mental health conditions prior to the pandemic, who were having thoughts of suicide or making attempts at ending their life, those children then, I mean, as we said earlier, we have been in a state of crisis for many years prior to the pandemic, being worried about COVID-19, having family members, for example, who are healthcare providers who are going into hospitals, puts our youth at even greater risk. We certainly have youth whose parents have been working in assisted living facilities and couldn't leave, those that are working in hospital systems, disruptions in their routine, disruptions in isolation. As we know, our children, all of us as people, are very relational, and our children for 2 years now have been interrupted with learning and gathering in groups and those kinds of things. And as was already said, the ACEs, I've been very, very concerned about all the children who've been at home who we haven't had eyes on. Abuse and neglect has gone up, right? Domestic violence has gone up. A variety of things have gone up that the warning signs are lagging. The calls to the hotline, for example, were down. So people believing that abuse and neglect was down because the calls to the hotline were down, simply not true. It really was a matter of we didn't have the same eyes on children, the same people who routinely would call the hotline were not calling the hotline simply because we didn't have eyes on them. So there's what looks like trend lines that are suggesting that we're doing better with children's mental health that haven't been presented here today, but that we're actually, doing worse. And of course, we know that instability has occurred over the last 2 years. Certainly, we're seeing that right now with the housing frustrations and rents going sky high, and people, the amount of back to social determinants of health. If we don't have children who have stable housing, and or access to food and those kinds of things. The one statistic that I think that we all have to appreciate, we see it probably every day when we turn the news on, is that the U.S. has achieved, somewhere around 900,000, getting close to 1 million people who have died as a result of COVID. The number that I think is important for us to understand is that it's estimated right now that 60,000 children have buried a parent as a result of a loss from COVID. And so we have to appreciate the loss that, what have our children lost? The other thing, though, that that in terms of my perspective is just really around COVID fatigue. I really think that parents are fatigued, children are fatigued, all of the caregivers are fatigued, and parents are having a hard time paying such close attention to the needs of their children for an extended period of time, for 2 years, and with no real end in sight. I think that this idea of, when we think of an emergency, we think very short term. We think kind of this beginning, this middle, and an end. And we don't consider an emergency for 2 years and beyond, which is really where we are now. And quite frankly, I hear from a community mental health perspective, I hear parents and others kind of using language about getting back to normal. And I'm not sure we're ever going back to normal. I think this idea of kind of embracing what is a new normal is a hard thing for people. Even though we're using some of that language, I consistently hear, right, I want to get back to the way it used to be. And I'm not sure we're going there. I worry particularly about the long haulers. So we talk a lot about long haulers from the perspective of physical health conditions relative to COVID. I want us to start talking about kind of the long haulers as it relates to the mental health of our children, children who are 9, 10, and 11 today. What does it look like 5 years from now, 10 years from now, as a result of the impact of what we've experienced for the last 2 years? How has that changed the mental health of our children? And I don't think that we know enough yet about what that will mean. Certainly we will see resilience. Certainly we will see strength. But I also wonder if we will see an increase in anxiety disorders and depressive disorders, relational disorders, other things that, from a long hauler perspective, that I think we should pay attention to. The other two things that I know I'm running out of time. I think they've been said. The workforce, the thing I want to make sure people understand, all of us understand, is that the workforce also has mental health. So the mental health workforce, their mental health is also struggling right now. They too, right, have lost people. Most of us probably listening today know somebody who's been lost to COVID, somebody who's had a very scary experience related to COVID. And so our workforce, the Great Resignation, all of those things are also impacting community mental health. And we need to do as much as we can really to acknowledge that.
April, I couldn't agree more that we have no idea what the future looks like with ourselves, with our kids. You're right. There's not going back to what we used to have. And yeah, just the things I'm hearing, especially with our kids, they're not able to relate as easily. And it's only been 2 years. I mean, if this continues, well, let's hope this doesn't continue. So the next year we can do this in person and not have to worry about technology, maybe. But I am hearing that anecdotally, more people are open to talking about mental health and seeking treatment. Are we making some progress in the destigmatization of mental health, April?
Yeah, I it's hard to use language like silver lining when we're talking about a pandemic, but I do believe that a silver lining in what we've collectively experienced for the last 2 years is that there has been a significant reduction in stigma. People are asking for help. There is this collective common kind of bond that we all have. An example I would give you is that I was meeting with my bankers a couple weeks ago. I was meeting with my bankers, and as the meeting was getting ready to start, one of my bankers literally said to me, April, in a room with several people, April, I'm having a hard time sleeping. My thoughts are really keeping me awake at night. I've been so very concerned. He really started to talk to me about his mental health, and I made a note of it and really said even to him how proud of him I was, and that that's the kind of thing that we're seeing, is that we're able to talk about, right, there is no health without mental health. We all have to be willing and able, and what I'm seeing now of late is that people are able to say, I'm really having a hard time. But the population that we're seeing probably the most that is new is really frontline workers. So nurses, physicians, law enforcement, teachers, the people that have historically been thought to be, not in need of mental health support because they were the helpers. So this help for helpers is really something that, most of us probably listening have paid attention to. Burnout and compassion fatigue and all of those things we've paid attention to for many years. I think now it really is on the radar for people who weren't considering that before. But I am absolutely seeing a good thing from the perspective of parents are willing to ask for help. They're willing to talk to their pediatricians, and people who are in need of services are willing to ask. A statistic that I think has been alarming for many years is that those people who need mental health services of a professional, only about 45% of them ever actually seek treatment. I think we're starting to see that trend line change. That now, just from what it feels like, I don't have a statistic to give you, but what it feels like is that number is actually rising. That now maybe closer to 60 or 70% of people who need a service are willing to ask for it.
Well, that's, I guess, good news, April. Thank you. Hopefully that will continue. I mean, I'm seeing that with just my friends, my neighbors, my family. Shocking. Well, thank you. And thank you also to Drs. Choe and Katzenstein for your time and insights this morning. You've all really brought to the forefront the challenges faced by our children, our families, our clinicians, our teachers, and our organizations. Our next panel is going to highlight the efforts currently underway to address these needs. But first, we're going to try a video interlude, and if it doesn't work immediately, we will cut it out. But we're going to try to show you this video done by Johnny Crowder, who's a Tampa Bay native. He has overcome his own adverse childhood experiences to become a successful entrepreneur in the area of mental health, and I think you will find his message very compelling.
Y'all, my name is Johnny Crowder, and I am the founder and CEO of Cope Notes, and I'm also a huge mental health advocate. I love doing public speaking and raising awareness about what mental health actually looks like in our daily lives. And actually, a big reason why I'm not with you right now is because I am doing my second TED Talk about mental health. Obviously, this is my favorite subject to talk about. And then the talk is titled, Why I Don't Want to Die Anymore. And what makes that really impressive, not the fact that I'm giving a TED Talk, but the fact that I don't want to die anymore, what makes that really impressive is my history. I guess without context, without knowing who I am or where I've been, someone not wanting to die probably isn't that impressive. It seems kind of normal. But for me, this is a monumental victory. 10, 15 years ago, there's no way I would have ever thought I'd be where I am today mentally. So here's some context. I grew up in a really abusive environment. I know a lot of you have read about ACEs, the adverse childhood experiences. If you can think of a category of ACE, it is likely that I lived through it at some point. And I'm taking a lot of comfort in knowing that what happened to me wasn't for nothing. Like overcoming the adversity that I lived through as a child has created an opportunity to help other people. And now it's my favorite thing to do. So my recovery was not linear though. It's not like my chart was always going up and to the right. Actually, ever since I was a kid, I had been self-harming and I was hallucinating as a toddler, elementary school, middle school. By the time I got to middle school, high school, it was really challenging for me to communicate with other people. It was hard to make eye contact. It was hard to speak. And there really wasn't, actually my first TED Talk was about how I never had that like aha breakthrough moment. I'd always hoped for one, right? Like, that's the story that everybody wants to hear is he's going through his life and everything's brutal. And then one day everything changed. And that's not really what it was like for me. It was, I never had that moment. It was like lots of hard work and sort of brute forcing my way through treatment. Actually, I started treatment in high school. It was against my will. My mom actually forced me into treatment. And my curiosity got the best of me, and I started taking psychology courses in high school, which then led me to pursue a degree in psychology at UCF. And then I got involved in peer support and public advocacy. And that's really where my heart kind of found its home, was in this idea of peer support and connecting with other people. And eventually I would found Cope Notes, which is a mental health technology company that provides daily mental health support for people all over the world. But I do want to mention this, like, this is not the part of the digital revolution where I come to take your jobs or I invent something that works you out of a job. The fact is, I'm not trying to do that. Like, you saved my life. Like, without treatment, without medication, without therapy, I wouldn't have even been alive to invent Cope Notes in the first place. So what you are doing for people who are ready for treatment, Cope Notes does for people who maybe aren't quite ready for treatment. And I did want to mention that, like, while we are on the same team, we're not here to talk about me. And just for a moment, let's try not to remember that we're here to talk about youth. Let's take a few minutes to make sure that we don't forget about you. When you're talking to the people that you serve, consciously, like, you can never tell what someone's going through or how dark it is. Like, we give people that benefit of the doubt all the time, but we forget to apply it to ourselves, that we might be going through something real and challenging. Not to mention the compassion fatigue that I know a lot of you are experiencing right now. You feel the weight on your shoulders, and you wouldn't work in this line of work. You wouldn't work in this field or industry if you didn't actually care about the people you're serving. And that can feel heavy, but don't forget that mental health touches all of us. So even clinicians aren't immune to having to take care of their mental and emotional health. And I've fallen into this trap where I think like, oh, I read this textbook, or I watched this lecture, or I went to school for this. And it can fool you into thinking that you're in an other category, like these things don't apply to you. And it can be challenging to share your experience, what you've been through, because you might be concerned that it might look like it devalues your expertise, or it might not look professional, or maybe you're in like a caregiver or leadership role and you're like, I don't want to tell people what I'm going through. I want to be strong and have a stiff upper lip. But my buddy said something really good yesterday. She said, don't trust a therapist who isn't in therapy. And I think she was like kind of being flippant, but there's truth to it, right? Like you wouldn't want to sign up for personal training with a personal trainer who is not in great shape. You want to seek help and advice from people who are walking the walk. And maybe you're not experiencing psychosis. Maybe you're not falling into the categories of exhibiting certain symptoms that you would associate with mental illness. But the fact is, because I know your line of work, I know that you are facing sustained stress and fatigue. That's not wrong. You are dealing with a lot of stuff right now. There's a whole spectrum of stress and negative self-talk and overwhelm and burnout and loneliness that all of us are living through right now. Don't disqualify yourself from that part of the mental health conversation. It's not for those people. It's those people that you serve, and then clinicians and people who know their stuff are actually totally fine all the time. That's not relatable. And me trying to put on a perfect face and look like I had it together actually further isolated me for so long, because it's not easy to relate to someone who has a perfect day after a perfect day after a perfect day. It's much easier to relate to someone who says, I'm having a roughie. I'm going through some stuff, because then you recognize that both of you are human. That's really been the backbone of peer support for me. A big reason why I do advocacy in the first place is because labels and stigma, both you judging yourself for not wanting to open your mouth about what you're going through, and also maybe looking side-eyed at someone who is going through something, whether you want to admit it or not, that type of stigma, self-stigma, kept me out of treatment, and it almost killed me. I almost died because I was too busy judging myself, saying, what would it mean if I open my mouth, and what will people think? And what does that say about me if I use a mental health resource? That thought process almost took my life. And if you can't tell, I'm pretty passionate about this stuff. And a lot of people ask me, when will I retire? Like, when will I give it up and pursue something else? Like, music, or like fashion stuff, sneakers. I love that stuff, but I'm not going to retire until the general consensus among the human population is that physical health and mental health are of the same importance. One day we'll just say health. And when that happens, I will be retired in Hawaii with my toes in the sand, sipping a virgin daiquiri. But until that day, I have my work cut out for me, and you have your hands full too. But how lucky are we to do this work? How lucky are we to be busy with what we're busy with? The fact is, you're changing other people's lives every single day with your work. You are a hero to them, a modern day superhero. I'm not exaggerating. You are changing and saving lives. But don't forget to be a hero to yourself. And one thing that getting older has taught me is that sometimes you cannot be your own hero as badly as you want to be. Sometimes you can't be that for yourself. But the good news is you're probably sitting next to one right now. Or maybe the person in the Zoom window next to yours is a hero. And all you have to do is stop judging yourself for long enough to open your mouth and acknowledge that what you're going through is real and challenging, and that you are a person too. Fact is, the only reason I'm still alive is because of people like you, because of treatment, because of medication, because people like you have chosen to use their time and energy to support people like me. But peer support, being able to connect with someone who understood me, taught me that I wasn't isolated. It taught me that people cared about me. It taught that other people got it. They could comprehend what I was going through, and I had no idea. And I promise you that you will be overwhelmed when you finally open up and realize that other people have been waiting in the wings to support you, just waiting for you to open your mouth and relate, to share about what you're going through. So thank you for doing all of the work that you do for other people. And today, please try showing yourself the same compassion you show the people you serve.
Good morning. I'm Becky Albert, Senior Manager of Strategic Initiatives at the Juvenile Welfare Board. And I'm so glad that we got to see Johnny Crowder and hear from him. He's such an inspiration in talking about overcoming adversity and how he's using his experiences to help others overcome challenges of their own. He's definitely given us some things to think about, which is a great segue over to our next panel of experts who will be talking with us today about efforts that are currently underway to address children's mental health right here in Pinellas County. We have a lot to cover, so I'm going to begin by asking each of our panelists one question, starting with Dr. Nichelle Threadgill, Chief Medical Officer with Evara Health. Good morning, Dr. Threadgill.
Good morning.
In the context of children's mental health, what is one thing you think we've done well this past year?
I would say the one thing that we've done well is increase access to behavioral health and behavioral health services. We have been able to provide care when care may not have been readily available, and to have been able to get children and families into services when they may not have chosen that road or may not have been able to get into services and navigate services. So providing that care, not just to the door, but through the door care, where they're actually not just given a referral and say, go find somewhere, there has to be somewhere around, but really getting them in so that they can get the right care that they need at the right time. And that has been pivotal and a great accomplishment, I would say, over the past year.
I like that. Not to the door, but through the door. Next, we have Kristin Mathre, Chief Operating Officer with Suncoast Center and of Zero Suicide Partners of Panelists. Good morning, Kristin.
Good morning.
Kristin, what would you say that we've done well?
Well, I have to say that in the last year and a few years, the thing that we have done so well that tags right onto that access is that collaboration and coordination of care. Our behavioral health system of care partners, our wellness connection partners, which include not just mental health and substance abuse, but the other areas of the community, the health care, the schools, the legal system, all of those, that we've been tightly knit together. Our partnership and our work that we've been doing has been knitting together tightly so that we coordinate those care. Our boots on the ground providers are experts in mental health and emotional wellness, in the treatment of trauma and stress, and they are such amazingly committed people. Now, yes, we do have workforce shortages, but I need to tell you, the people that we have on the ground working, I am so amazed with them, and yes, they are our everyday heroes.
They truly are our heroes. And to round out our panel, Donna Sicilian, Executive Director of Student Services for Pinellas County Schools. Good morning, Donna.
Good morning, Becky. I love this question. I think that as a community, one of the things we've done really well is to begin to chip away at the stigma. April Lott mentioned it in the earlier panel. Johnny just mentioned it in his talk. And I think that what Dr. Choe talked about with the Youth Mental Health Advisory coming out of the Surgeon General's office, all of these things have helped us begin to break through the stigma. I think as a school district, what we've done that's been very important is that we open schools quickly and safely. We open schools so that students have access to the mental health professionals we have in schools, to the teachers and adults that care about them and are concerned for them, and to each other. They need those peer relations. So I think the fact that we were able to get students back into brick and mortar schools quickly and in a safe way during the pandemic is really something that we have accomplished that's been extremely helpful for youth mental health.
Absolutely. You know, it's impressive to see everyone working together to protect youth mental health. And we're really focusing on prevention and ultimately increasing access to mental health services for our children. You know, we have all experienced challenges over the past couple of years, yet despite the adverse experiences, there actually have been some bright spots, the Children's Mental Health Initiative being one. I see we have a visual coming up for our virtual audience showing that more children are gaining access to mental health services within the pediatric practice at Evara Health. And in some instances, these children are gaining access in real time or same day. So Dr. Threadgill, how is this initiative making a difference? And in particular, how have you been able to increase access to mental health services?
Yeah, you know, I think that what you see illustrated in the bar graph is a telling story that in the first year of the program, we saw about 1,500 behavioral health encounters, which, you know, kind of quickly increased to over 3,000 encounters by year two. There were several things that went into increasing that access, but one of the key things was the same day behavioral health visits that we were able to accomplish. And it was really creating that opportunity for families to get in and get seen without that gap of the navigation of referrals and into a building and find another building and things like that. And so that made a huge difference. You know, I think the other element that led to an increase in management treatment was our ability to really give our physicians, our pediatricians, our pediatric providers additional training so that they could be better equipped to diagnose and manage some of the low complexity or moderate complexity behavioral health conditions. We've heard a lot earlier today about the system being overwhelmed and the specialists being overwhelmed and the limitations in the number of specialists available in the community. One of the ways that we have really worked to combat this is by improving the expertise of those that we do have. And so by helping our pediatricians be more of an expert in managing some of those behavioral health conditions, it really has made a difference with limiting some of those referrals that ordinarily we would have just, you know, kind of automatically had to refer out to a specialist. The other really key part, which Kristin mentioned earlier, is coordination. And so we have had priceless relationships with community partners, including Pinellas County Schools, Department of Health, our community mental health organizations. And they have really made a key difference in getting patients the right care. And so the care that we're not able to provide at Evara Health, or services that we don't offer at Evara Health, we've had key partnerships that we can easily transition patients into and navigate them to the services that they need, while still having that collaborative relationship with the family, having that relationship with the children, and having a relationship with the place that they spend most of their time, which is at school a lot of times. And so those have been really keys in improving our access.
So it sounds like relationships with the initiative really play a critical role with coordinating care. So talk to me about the importance of relationships with this initiative.
Yeah, you know, I think that what we've realized is that not one of us can manage all things, and not one of us can manage everyone. And so those key relationships have been really the key to what the Children's Mental Health Initiative has been. It has brought the community together, looking at data that tells us where we have shortcomings, where there are challenges, and helped us to really try to build bridges to address those areas that we can see there's clear need, and how do we get the need to patients and people that we need to get there. And so those relationships have just been absolutely critical in making sure that patients get the care that they need when they need it.
That's excellent. And as we know, mental health is truly a continuum. So as we transition to a more difficult topic about youth suicide and suicidal ideation, let me ask Kristin, what's being done to address this growing issue in our community?
Thanks, Becky. This is just so really exciting for me, because back in 2018, the behavioral health system of care said, hey, we got a big problem. We all need to come together to address suicide in Pinellas County. And so they said that, okay, we'll do this community impact initiative all together. How are we going to go about it? So we started the Zero Suicide Partners of Pinellas. It is not about behavioral health, because suicide is not something that only happens for somebody who is mentally ill. It is about all of us together. And so when we got together, we said, how are we going to transform our response as an entire community? So we got together, about 35 partner agencies. We did our assessments, our internal and our external assessments, and we came together using the Zero Suicide methodology, which is a nationally recognized methodology, to put forth suicide prevention care pathways. And these care pathways are happening throughout our system. They start with assessment, screenings and assessments, and they lead to interventions. What's most exciting for me is that here in this last year, we have started to, we've been collecting numbers for several years, but when you're talking about that care pathway and those assessments, we're using a common one across all of us, the Columbia Suicide Prevention, I'm sorry, I just lost the name of it. So the Columbia, and we're all using it. We're even using it in the emergency rooms as that start of that care pathway to find out if somebody needs help. And as we do that common screening, common assessment, move the folks that need to into the right sector of treatment, we're reaching more people. In this last year, and as I said, that includes the emergency rooms, it includes pediatric settings. In the last year, we completed 195,000 of these assessments. Those are people touched, that we asked all the right questions. So important that we start at that point of asking the questions, and that it's not just happening in behavioral health settings, or just happening when somebody calls the lifeline, or just happening anywhere, because anyone can ask these questions and help somebody get into care. So,
and I think, Kristin, you were referring to the Columbia Suicide Severity Rating Scale.
Thank you. Oh,
yes.
Quite the day, right? Quite
Yes.
the mouthful.
Yes.
So I'm going to say that we need more. We need to assess at even more touch points. Absolutely. But last year, we completed 195,000. But what does that lead to? For those folks that need a further intervention, going further into that suicide prevention care pathway, we are all using the same safety plan. It is a very important intervention. It is a Stanley Brown safety plan that's also out of Columbia. And this recognized intervention really hits the points for us because it's effective. Depending upon the study, this one intervention has shown to have between a 45 or a 55% reduction in suicidal thoughts and behaviors. This single intervention. And it's not that hard. So really, the other pieces to that, though, and how it fits well within all of our care pathways, and we've got it in all of our electronic medical records and in all of our processes and their different agencies and settings. It also fits our accessibility criteria of being kind, being curious, and being connected. It is trauma informed, it's recovery oriented, and it is so individualized and personal. It can be inclusive of all the resources that are specific and available to the youth and the families that we're working with and that we're talking about. And it has it so that there can be this simple roadmap that the youth, that their families, and everyone can take with them. There's even an app for that. There's actually several apps for that. You know, you can take it with you. And the thing about taking it with you is you can also be that connection point for someone else who's taking it with you. So,
you know, what you're saying is so important, Kristin. Checking in with one another, making the connection, and creating a safety plan when necessary. I know that there's a phone number that you want to make sure everybody has in their phone.
Absolutely. That's the National Suicide Lifeline. It's 1-800-273-8255. I do want to say another thing about what the Zero Suicide Partners, and that's all of our partners, have done in this community in regards to the safety plan. Last calendar year, we completed 20,000 safety plans among all of our different agencies. We couldn't do, none of us, like Dr. Threadgill said, none of us can do this alone. Doing this together and making sure that those go back and forth in the process of care is so very important.
Absolutely. And, you know, Kristin, I hear that you've also been hosting a series of community conversations, and you're targeting specific populations, with youth being one of the populations that you're targeting. So can you talk to us about the purpose of these events?
Absolutely. So our Zero Suicide Partners of Pinellas, we got together and we said, okay, how do we get the message out there? I'm going to say to everyone else, because I want everyone. I don't care whether you are a senior, a parent, an adult, a child. I want everyone to remember some really simple things: to be kind, to be curious, and be connected. To be kind, because even a simple greeting or a small bit of help could be that one bright light, that one connection that makes people say, hey, I'm worthy and I'm here. To be curious, because I want no one to forget to ask somebody or not think it's okay to ask someone when they look like they're not doing well. I want them to ask, are you okay? I want them to ask, do you need help? I'm worried about you. Are you thinking about hurting yourself? Not to be afraid to ask and to be connected. Connection is a powerful and curative resilience factor. Like Donna said, it was so important for the kids to be in the brick and mortar and have somebody to be connected to. Don't be afraid to have that lifeline in your phone. I want everyone to have it in their phone, and don't be afraid to offer it to somebody else and make sure that it's in the phone of all of your friends and family. So that's the message that we're getting out. But how are we doing it? Person to person. What groups have we started with? Well, We've identified 3 populations of concern: the LGBTQ plus community, the veterans and their families, and the youth. For the LGBTQ plus, we've done 1 town hall already. We've got surveys going out to try and get more information on how to better connect with them, because we need to better connect and better get that information out there. With the veterans, it's actually kind of fun for the veterans and their families, because we know a lot of veterans are not connected to the VA services. And these are really the folks that we are very concerned about, them and their families, because they have a very high rate of suicide. So we're connecting them through they're actually little coffee social type things that are spreading the information around. And we've got those getting started up with the help of veterans. And then we've got the youth town hall coming up in April. And that's going to be a really exciting event that Johnny Crowder is going to assist us well, and is a great collaboration with the Community Mental Health Initiative. It'll be at the Tarpon Springs campus in St. Petersburg College, and it's both a session for listening and for action, because we know everyone in this community can take action to prevent suicide. It is not just a mental health issue. It's not just a behavioral health issue. It's an everyone issue.
Absolutely, Kristin. And I heard being kind, being curious, and being connected, which really leads me to wonder what's happening in our schools. Donna, how is the district keeping pace with the ever-changing landscape of children's mental health?
Thank you, Becky. We are swimming and paddling as fast as we can to keep up with youth. It often feels like youth are always a step ahead of us. But I think here in Pinellas County, prior to the pandemic, we had a great head start. We have been working really for decades to build a trauma-sensitive school district, like 1 classroom at a time, where we recognize and understand that we can put in universal precautions, really, that show that any child that comes through the door of a classroom of a school building could have experienced trauma. And like so many of our speakers today have taught us, we are certainly seeing an increase in the number of students and families that have trauma in their life, particularly through the pandemic and the losses associated with it. So we continue to build a trauma-sensitive district with trauma-informed care trainings for staff. We have been engaged now for over 2 years, really over 3 years, with the Sandy Hook Promise Initiative, which has a whole continuum of services. We start with a program called Start with Hello, which really is a connection program that brings youth together with their peers in an effort to reach out and make sure that no student is isolated, no one's sitting alone at lunch. Really an effort to increase students engaging with each other. We also have the See Something, Say Something, which is a training in all middle and high schools that helps students recognize signs of potential harm to self and others. And it also gives them a platform to report that to a trusted adult. They can talk to trusted adults at school and in their life, but there also is an app that we have them download on their phone, and a website and a phone number, so they're able to anonymously report. We've had over 9,000 tips since we started this. Students will see something on social media and they will alert trusted adults. It's manned by a 24/7 crisis center. And so this partnership has been excellent, and we are beginning the Say Something, Stop Suicide program. We recently trained all middle and high schoolers, and we're piloting some training for families and also for educators. So in addition to that, we have 5 hours of mental health training for students on a variety of topics. That includes, bullying prevention, conflict resolution, suicide, depression, anxiety, how to be resilient, and so forth. So We have received funding both at the federal and state level specific for mental health. And so there's just a lot of efforts going on to keep in step.
It sure sounds like it. And, you know, it's wonderful to hear that your board and the leadership are really on board with supporting students in their mental health. I know that the schools have an array of training for teachers and staff. Can you tell me about the type of training that teachers and staff are receiving, and how is it helping to support youth mental health?
Certainly. So as I mentioned a minute ago, we are doing a lot of trauma-informed care training. We also have suicide prevention training. We are trying to saturate our school district and community with youth mental health first aid, which is a training kind of based on the model of CPR, where you teach lay people how to recognize signs of mental health, how to stabilize someone who may be in a mental health crisis, and then how to connect them with help. So we are working hard to train all of the adults in our school district with youth mental health first aid. We also have what's called Cognito, which is a 90-minute online training that is sort of a higher level view. And we provide that, and we really have all of our district staff currently Cognito trained as we work through the youth mental health first aid training. In addition, we trainings on supporting LGBTQ students. As Kristin mentioned, there is a statistically higher rate of suicide among our youth that are in the LGBTQ+ community. So we work hard to train adults on how to support students. We do bullying prevention, the Sandy Hook Promise trainings we talked about. I think it's important to mention, because you go, oh my gosh, that's a lot of training. So what we have schools do is through our prevention department, we provide each school team with a rubric that has data about their school population of students, and it also has data about what training the staff in their building have already taken. And each school develops a plan every year of what are we going to focus on this year. So we have this wide breadth of available training, but we really help individual schools target what do our students need in this moment, what have our staff already obtained in terms of training, and what is our plan moving forward for the next school year? What do we need to bring into the building for the adults to support the youth?
Sounds like you guys have a lot going on, and thank you so much to each of you for all the work that you're doing to support children and families, because you really are creating bright spots for children and families in our community, specifically increasing access to services, being kind, being connected, and increasing education for adults who regularly interact with children. And although that there has been work that has begun in our community to protect children's mental health, the need is so great. And as noted in the Surgeon General's advisory, many of the actionable recommendations require structural buy-in and systemic change. Now is the time for us to demand change. And here with me now to talk more about advocacy and a call to action, actions that we can all take to protect children's mental health, is Melanie Brown Wifter, CEO at Florida Behavioral Health Association. Good morning, Melanie.
Good morning.
Melanie, thank you for being here. I wanted to ask you, what are some of the missing pieces or legislative priorities you are recommending for youth mental health?
Great. Well, thank you for the opportunity to be here. And it's incredible to hear the work of the JWB and the collaboration that's occurring in your community. And collaboration is one of the missing pieces. So we see local events like what you've done in Pinellas County to bring together healthcare providers from crisis services through community mental health and substance use treatment, bringing in the schools, addressing things like food insecurity and housing insecurity as well. And those are wonderful, wonderful efforts, bringing in public health. And it's going to take that sort of approach, including public safety, law enforcement, to be able to address the problems that we're seeing. So part of it is sharing information that still protects the privacy of the individual. We talked about stigma, and so that, that is still a real fear and is a barrier to care. But bringing in that approach that we can all sit at the table, and many of the individuals that we're seeing, we see across silos, meaning that the child may be in school and maybe receiving some services there, and then maybe they're seeing their pediatrician and they receive a service there, and then maybe the family, accesses some other services and those are there, but there's not a way to collaborate or communicate what's going on across the way. So that's what we need to look for. And part of that happens locally, like what you're doing. Part of it is with innovative service models like the certified community behavioral health clinics, which integrates physical care and mental health care in one, and works to address with community partnerships those other social determinants that are needed. So, that is that coordinated approach is certainly something that we need to look for. Pinellas is also very fortunate because you have a strong legislative delegation, all the way from Speaker Sprouse, Representative Lott, who's been very involved, Representative Poster, Senator Roussan. All of those are really, really supportive of both mental health and substance use services and individuals in need, as well as your local county commission and city commission, because of their willingness to fund programs, but also to put up county match, which allows us to leverage state dollars and federal dollars to enhance the funding in our system. And funding is obviously one of the major barriers that we have, and one of our missing pieces in terms of policy. We know Medicaid rates have not been increased in a number of years. We are seeing the demand for services increase, and we're very concerned about capacity, as you've heard from our panels today. We're seeing some innovative solutions being addressed, but obviously, those have to be sustainable in order to be able to reach the population. And we also need to look at our reimbursement and our policy from the perspective of, if a child comes in for service, we really need to be able to treat the family, because if you address the child's issues and then send them back to the environment and the parents have no support and no training, then we're not going to make any progress, and we're not going to see that child progress as they could. You heard Johnny talk about, he had thoughts early on. We know 0 to 9 is, children often have symptoms early. We know that adolescents have a different set of symptoms, and behaviors, and then that carries on into early adulthood. So we need to be able to address, those children's needs, as well as support that family and make sure that those services are available, and then look to preventative efforts as well. The suicide prevention efforts, education, training, making it okay for us to talk about mental health. And then one last thing I'll say is about workforce. And you've heard this morning too, this is the pandemic has brought on the year of the Great Resignation, or the Great Realignment, in which we've seen individuals who are at retirement age elect to retire early. We are seeing individuals decide if they're going to work, they want it to be at something that they want to do rather than something that just brings a paycheck. And so in the healthcare sector and sectors all across our economy, we are seeing that the workforce is leaving. And so we do need professionals to stay in. We need to be able to grow that pipeline, reduce barriers to having licensed professionals enter into the workforce early, being able to pay salaries, looking at workforce culture and how we can retain and recruit individuals to come in. So there's lots of efforts underway, not only in our state, but in our nation. And one last thing I'd like to say before we move on is that what you're seeing in the Pinellas area is what we're seeing across our state and actually across our nation in terms of mental health and substance use, and the increased demand and the impacts that the pandemic have had.
I couldn't agree more with you, Melanie. We really need to focus on patient-centered, or the whole person care, having a coordinated approach, including the family. We need increased reimbursement for mental health services, and we really need to stabilize our workforce. Are there any other advocacy opportunities we should be aware of?
Oh, absolutely. I think Johnny talked about it, and we've heard it earlier today, stigma. Addressing stigma is going to be very, very important. Our older population, and I'll just say, and when I'm saying older, I mean parent age all the way, through the continuum, still have the stigma and the concern about seeking mental health services. They're concerned about the impact downstream on their children if they access a mental health service. Will they get into college? Will the military accept them? Will they get that job promotion that they're looking at? And so even though we're seeing conversations around the dinner table, we are seeing events like this one and people actually talking about their mental health and their well-being in public, we still have that secret behind the scenes fear that if we talk about it or if we seek a service, that it will somehow marginalize us or limit our ability, to get that promotion or to be able to thrive. And so we need to change that into looking at mental well-being and looking at our whole mind-body continuum, and that actually accessing a service is a sign of strength because you recognize your need and then you do something about it rather than it being a sign of weakness.
We definitely want to normalize mental health. And in fact, here in Pinellas County, we had held some focus groups with parents and caregivers. We also surveyed youth. And what's interesting is we asked both groups the same question. What comes to mind when you hear the term mental health? As you notice from these word clouds, they clearly demonstrate the differences. Youth are more focused on their feelings and really in the trenches of feeling depressed, while their parents and caregivers are really more concerned about what others may think, the stigma that is associated with mental health. Melanie, would you say that stigma is the major barrier for people to access care?
Absolutely. This graphic completely illustrates what we're dealing with and what our professionals are seeing, and that the children recognize that they have a need and they have no stigma. They want a service. The parents are the ones, and the older adults see that stigma and are very concerned about access. So we have to be able, again, to reframe the conversation, break down those silos so that, children who are seen at school, there's a link to the community wraps those parents and that whole family in care, and that we can really work to see that it is okay to seek a service. Again, it's a strength, not a weakness, to be able to address the need that's there.
So I remember Kristin talking about the upcoming town hall focused on youth, and really it's meant to grow hope, providing tools and connections for youth and their families. The event is really going to provide an opportunity to highlight youth voice, provide resources, and most importantly, offer hope to young people and caregivers. So Melanie, I hope that you'll look for more information about this event to come, as well as our virtual audience, which is available in the coming weeks. So Melanie, thank you so much for being with us today and for all of the work that you are doing on behalf of children and families. So we've heard about efforts that are currently underway, and we've been given some very specific recommendations that we can all act on when we leave here today. Now, before we end our time together, I'd like to welcome JWB Board Vice Chair, the Honorable Patrice Moore, who will offer a unique perspective as a circuit court judge. She'll also provide closing remarks. Good morning, Judge Moore.
Good morning, Becky, and thank you very much. This has been an informative summit for myself. As you've heard, there are still gaps, needs, and work to be done in protecting our youth's mental health. While all of the missing pieces shared are important, some may be more relevant to your leadership role in the community. And if you can get behind just one of these causes, we ask that you do that. Because remember, we can't do it without you. We can't do it alone. And mental health is an everyone issue, not just a JWB issue. As we close today's 8th Annual Children's Summit, there are just a few reminders. Please download the summit material and connect with today's speakers on their relevant pages. Today's event is being recorded and will be posted on JWB's YouTube page, and we ask that you go there as well. Visit the JWB site at jwbpinellas.org to learn more about our important work and investment in our children in Pinellas County. Also, please remember to save the date for April the 29th. and join us for JWB's 75th Anniversary Awards Luncheon at the St. Petersburg Coliseum. And this will be a very important and very special luncheon to us all, as we will honor the late and great Mr. Bernie Mccabe, who was an icon in the community and a champion for the youth and families in Pinellas County. And we will honor Bob Dillinger, who was the hope as he served as the public defender in the 6th Judicial Circuit. So please come for this very special award. Thank you for joining us today, and please enjoy the rest of your day.